Hey there, everybody. Mace here. The microbe that I've decided to cover today is respiratory syncytial virus. Given that myself and several of our peers in the class work at a pediatric urgent care, this is a virus that we are very familiar with. But if you don't work around it, this is probably also something you've either seen in the news, something that you may have seen advertisements for vaccines about. Actually, the vaccines that I'll be talking about a little bit later, Dr. K has mentioned in one of her prior respiratory viral infections PowerPoints, so those might be reminders for you today. But given how big of an infection this tends to cause all throughout the United States, especially in those in vulnerable populations such as the elderly and children, it's pretty important that I think we cover this topic and just kind of see what impact it's making and how we can try and reduce its impact going forward. Here are some of the topics I'll cover throughout the presentation today, but I'll also have cover slides as we go through each one, just as a reminder. So first being though, what is RSV? You've heard about it, you've either seen something about it, but what does it look like? What is it doing? How is it functioning? Let's kind of see the basics of what is RSV. So respiratory syncytial virus, if you kind of look at it, it's going to look pretty similar to a picture that you've seen of either a coronavirus or an influenza virus, and that's because it's very similar in its build makeup, and that is that it is an enveloped capsid virus with outer proteins that bind to host cells. Very similarly to influenza and COVID-19, that's essentially what it's doing. It's binding to host cells, being engulfed by that host cell, and then doing its damage once it's been engulfed. Its primary form of metabolism, like many viruses, is going to be functioning off of the host cell's organelles and structures, whether that be the genome, the DNA that's located in the nucleus, the mitochondria, the Golgi apparatus, the endoplasmic reticulum. It's going to use those organelles to make more of itself and spread to new hosts as it is infecting each individual host cell. And before we go forward into any virulence factors, I did want to mention the two major ones that I want you to keep in mind, and those would be the G and F proteins there on that outer envelope. Basically, those two proteins are the key features to how RSV functions as a virus, and it's just good to go ahead and keep those in mind as we go throughout the presentation. Looking at it, you can kind of see there on the left the different steps that I've listed here just out in words, but I kind of wanted to break down the picture of the metabolism steps here on the right. As you can see, the RSV virion there in the top left corner, it's binding to what we would assume here to be a upper respiratory epithelial cell, given that those are the cells that primarily have the necessary receptors for RSV's G and F proteins. That's why you don't see RSV infecting a lot of other cells throughout the body, because it has the receptors to engulf the RSV virions. Once RSV is engulfed by the host cell and brought in, it forms various complexes in order to reproduce its genome. That is then integrated into the nucleus to replicate certain proteins via the endoplasmic reticulum. And then this, in pair with the Golgi apparatus, is what allows it to make new proteins and new structures to make more virions, which will spread to other host cells as it keeps the host cell alive to do this function. Now, what virulence factors are allowing it to do this? Well, let's go ahead and kind of break those down as well. As I mentioned at the very beginning, the main ones to look at are G and F proteins, those adhesion molecules that are on the outside. These adhesins, as you look at the picture on the right, are those green and purple structures. The first one to look at, of course, being G protein. It's probably one of the most prominent when you're looking at RSV, are those little purple proteins that you see on the outside of the RSV's envelope. G protein specifically is the first binding protein for RSV. It will make the initial connection to the host cell that it's trying to infect. If you look at what it's binding to, its primary binding site is going to be to a outer protein on the host cell called annexin 2. It lines up perfectly with RSV's G protein, which makes it an ideal host for RSV. It can bind to other ones, as you see there, any of those purple ones that are binding to its outer plasma membrane, GAG slash HSPG, CX3CR1, the various proteins are going to bind to it and just allow it to make that initial connection. Fusion protein is performing a very similar function. Those green proteins that you see on the outside of RSV are also binding and adhering the RSV molecule to the host cell to try and get in. So you'll see it bind to ICAM1, EGFR, and any other protein that perfectly aligns with its shape. It has that kind of almost like an enzyme, that lock and key, where it has to kind of bind together in order to be recognized. The other big thing about G protein that it does is it actually activates the endocytotic process. G protein will essentially activate an ATP kinase, which will, as it goes down the EGFR process will cause the actin in the plasma membrane to bend and fold, which slowly engulfs the RSV molecule and brings it into the cell. And then as it's brought in, RSV will then be able to perform other functions with virulence factors that I'll get into on this next slide here. The payload virulence factors is what I call them, but the main name for them would be anti-immune proteins. So RSV does not have a cytotoxin that it gives off. It's not giving off a lysing factor. It's giving off anti-immune proteins. So this first one that we look at, NS1 protein, is going to bind to a molecule that your host cells produce called IFN1. IFN1 is a signaling molecule produced by the host cells in our body to try and activate and attract the immune response to come and deal with whatever infection is getting into the body. NSN1 protein is going to latch onto that IFN molecule and prevent it from getting out of the cell, meaning that your host cells can't attract a primary immune response, which allows RSV to remain pretty much undetected by the initial immune response once it's infected the host cell. The other big thing that we observe with NSN1 protein is that it alters your immune system once your immune system does respond. What NS1 protein is able to do is it actually can be excreted out from the host cell into the interstitial space. And what you'll see is that it'll first alter the amount of CD8 plus cells that are being produced, and this will reduce the overall amount of cytotoxic T cells that your body can produce to lyse infected cells and get rid of the infection. The other thing that it can do, though, however, is upregulate the production of mast cells, Th2 cells, and CD4 plus cells. All of these cells are linked to your humoral response, so the production of antibodies, pyretic cells, as well as inflammatory response cells. These molecules being produced in vast quantities cause major irritation and inflammation. And in the case of RSV, they essentially bring the mucuses and fluid out from the host cell into the intercellular space. And this overproduction of fluid irritates the cilia on the outside of your epithelial cells, which causes that unproductive and severe cough that we observe with an RSV infection. The corresponding protein with NS1 that we don't know as much about is NS2 protein, but from what can be observed of NS2 protein, essentially what it does is it binds to NS1 protein along with the mitochondria of the host cell, and it forms what's called a degradome. This degradome can essentially take any immune protein that the host cell attempts to produce and completely cut it out and degrade it and break it down. This is part of the tandem response with NS1 to prevent the immune system from mounting a proper response, which leads to the undetectability of RSV, which then allows it to alter your immune system before your immune system even has a good chance to fight it. So RSV is a pretty sneaky little guy, and it also is really good at making your immune system completely shift its course and its abilities when it's trying to fight an infection. Now, let's look at the pathogenesis of RSV and viral pneumonia. How does it go from primary infection to its now pretty nasty symptoms? If you just look at the initial RSV infection, you can basically get it from any infected surface, infected utensil, physical contact with an infected patient, or the most common form of spreading is just a cough. Since most patients with an RSV infection get a cough, they cough out the virions into the open air through aerosol particles, and those can be intaken when you just breathe. So in the first 2 days of an RSV infection, the virions are using their GNF proteins to bind to your host cells and fuse, and then through endocytosis becoming engulfed and forming those RNP molecules that we saw from that earlier description in order to reproduce more of its own genome and try and slowly integrate with the host cell. From days 3 to 8, the primary immune symptoms like cough, fever, fatigue, and runny nose are starting to flare up, and this is where we're seeing RSV upregulating your CD4 plus cells and your humoral response causing these symptoms, as NS1 and NS2 proteins are doing their job and altering your immune system overall. And these symptoms will last primarily for about a week, along with you can reduce these symptoms, but we'll kind of get into that later when we cover the treatment of it, as well as you'll see a downregulation in, of course, your cytotoxic T cells due to CD8 plus cells being reduced. Days 9 through 14, of course, you're now going to see some of these symptoms begin to subside as the infection is running its course. because your immune system has now had enough time to try and adapt around RSV in order to make proper immune cells that can target infected cells as well as virions that are in the intercellular space in order to overall eliminate the infection from your upper respiratory system. Now, I've taken a lot of time about RSV, but what about viral pneumonia? Viral pneumonia is just something that we're describing when there is a follow-up infection of the lower respiratory system in the lungs after a viral infection has been observed. If you're looking at viral pneumonia as a pathogenesis, like step by step, a patient will first recover from their upper respiratory RSV infection. Often you'll see this in the hospital where they're needing ventilators or some sort of nebulizer treatment in order to reduce their overall respiratory symptoms. In the first 2 days of the infection, the primary infection of the RSV has subsided, but however, any remnant RSV virions can slowly move their way into the lower respiratory tract and into your lungs, specifically your alveolar tissue, which has similar receptors as the upper respiratory system to accept RSV particles. After those 2 days of primary infection, like your RSV infection in the upper respiratory tract, it's going to slowly move into the alveolar tissue and cause symptoms more similar to pneumonia. So nausea, fever, severe chest pain, cough, and something that's going to be a little bit deeper than just that first unproductive cough that you see with RSV. And very similar to RSV, this will last for about a week as your immune system is trying to adapt to it. And then in the last 6 to 8 days of the infection, things will begin to subside as long as you're also using medications and other things to kind of help subside the symptoms. Now, I've kind of done all the doom and gloom, but what are some symptoms and treatments that we're observing when we're looking at the clinic? Of course, with RSV, your primary symptoms are going to be things like fever, unproductive cough, runny nose, wheezing, loss of appetite, just kind of some standard symptoms that you see with most viral infections. In very vulnerable patients, it actually can lead to death due to comorbid infections or viral pneumonia, which I'll kind of get into when I talk about prevention and trying to help those who are at high risk. When you're looking at how to diagnose RSV, the most common that we see nowadays is the rapid antigen testing via a nasal swab. Very similar to the COVID-19 antigen testing, you just get a very deep nasal swab in the nasal cavity and you sit it in an enzyme that breaks it down and it tests for a specific protein. I believe, from what I was able to find, it's primarily looking for the G protein since we know the most about it and we've been able to make a test that can find it. So it's trying to find that G protein present in your nasal secretion. Another way of doing it is just, of course, looking at the physical symptoms itself. You're going to have an O2 saturation percentage less than 95% as it's interrupting with your oxygen absorption via breathing. You're going to have a fever above 101.4, what we call a medical fever. And then one of the weird things is, even though there is an excretion of mucus from your cells, a dry cough is actually way more common with RSV because you've coughed up so much mucus that there's no longer the ability to have a wet cough. Looking at symptoms of viral pneumonia, again, it's that corresponding lung inflammation following an RSV infection because of your weakened immune system. Because RSV has altered your immune system, it finds its way into your lungs and causes the infection in your alveolar tissue, which is where we're seeing an even higher fever, like 102.8 or higher, severe chest pain, cough, fatigue. In patients who are older, you can find confusion due to low oxygen content, shortness of breath, and vomiting. When looking at prevention and treatment for these nasty diseases from RSV, most common treatments are going to be anything that's related to oral steroids and inhalant steroids. So in pediatrics, we often use a pediatric nebulizer with albuterol sulfate, which is just an inhalant steroid. That allows the airways to open up a little bit more and allow that oxygen saturation to come back up a little bit, given how much inflammation has formed in your lungs. Given that there's a fever associated, you're going to take antipyretic medications, things like ibuprofen, Tylenol, just to kind of try and get that fever down so you don't sustain any long-term brain damage. Replenishing of fluid and electrolytes, especially if you have viral pneumonia, that nausea and vomiting is nothing fun. So you're going to need to replace any sort of fluid you lose or any sort of electrolytes that you lose when you're vomiting up during a nasty viral pneumonia infection, and sometimes an RSV infection as well. In severe cases where people are having severe respiratory distress, you're going to often see breathing tubes or ventilators that could be necessary, especially in very young infants less than a month old. There are often times where breathing tubes are necessary because the inflammation and the irritation has caused so much damage that sometimes the lungs just will not function properly as they have just gotten more and more tired. when you're looking at the prevention for these things, for a very long time, there was not a way of preventing RSV. People would get it, and they would just have to deal with the infection. But as of 2023, the FDA has approved 3 vaccines that have been made for RSV preventatives. Um, the 2 that are primarily used that we've discussed before are RSV and Abrisvo. For the elderly, you can use either, and it's often observed prior to the RSV season. You've now seen it in test trials, and people who are above the age of 65 are eligible to receive the RSV vaccine. And so far, we've seen very good results from the use of this. 89% of those who have received the RSV vaccine have either not contracted RSV or have received very, very mild symptoms of an RSV infection, where otherwise they might see a more severe infection without said vaccine. Another thing is, and you're trying to reduce the risk of, is for pregnant mothers at 32 weeks or later. Given that 32 weeks is so close to the time of birth, you're trying to give them that vaccine so that enough antibodies can be brought into the fetus. So that way, at time of birth, the infant is going to be a lot more resistant to an RSV infection, or if they get it, the symptoms will just be very, very reduced. Some other just common sense reduction of exposure to RSV are going to be hand washing, when diagnosed and sick, isolation, and quarantining yourself. Especially parents, something that I've seen a lot of the times is they take their sick RSV having kid and they put them in daycare. And then everyone else in the daycare gets RSV. So don't do that. If you have an RSV infection, keep your kids or keep your grandparents at home, away, isolated. Or if you yourself have an RSV infection, even if it's less severe, just stay away from people. Try not to give it to people. Mask up and contain your symptoms to yourself. That's another thing that I mentioned here, is just covering up your mouth, or masking, just to prevent the spread of RSV to other individuals. Now, I say all this, and people would think that RSV is just a very mild thing, so why is it so important? Well, it's not as mild as you might think it is. It's a very treatable disease, but it's still deadly to the most vulnerable citizens, especially here in the United States. Here in the US, upwards of 8,000 elderly people are killed annually from severe RSV infections and contracted viral pneumonia from their RSV infection. That is a lot of people dying from a very preventable and treatable disease. So it's pretty important that we start trying to find ways to kind of prevent that many deaths in a very treatable disease. I also mentioned here just how many elderly get infected, especially in nursing homes and collections where there are a lot of elderly in one place. You're going to see upwards of 160,000 annual RSV infections in the elderly population here in the United States, which is just absolutely insane to me. That many people can get infected. I understand that means that it is a very low mortality rate. However, it's still not good to allow that many thousands of people to just die from such a very preventable and treatable infection. And then, of course, you also look at infants. Upwards of 3% of all infected infants, when they get RSV, will need to be hospitalized and put in the ICU, which is just traumatizing on the parents, traumatizing on the child, and requires resources that otherwise, if prevented, are not needed. And another thing too, that there are infants that die from getting RSV infections. Anywhere from 250 to 500 infants die annually from RSV infections in the ICU. And again, that's just a trauma that in a country like ours, we should not be allowing to go unnoticed and putting on new parents who have already had to go through the stress and trauma of becoming new parents. So again, given just how preventable and treatable this is, I think it's important that we try and take the effort, get the vaccines out, try and prevent the spread, so that way people can live much more higher quality lives, given that this is just such a mild infection in comparison to other things that we try and prevent even more. I used quite a bit of resources here, and I always tell this to people when it's RSV season: please don't kiss the babies. I just don't. The babies don't need your kiss. You can kiss them when they're older. Um, it's going to be a lot on them. So I hope this was informative. I know this was a little bit longer, but this is just something that I'm pretty passionate about, given that I've worked in peds for 3 years. And I hope that this is something that going forward, that many of us are going into the health field, we can have a passion about, to try and prevent these kind of diseases and treat them properly so that people can have a higher quality of life. I appreciate y'all taking some time to listen, and I hope y'all have a good day.